Alzheimer's and dementia. It's something that has impacted on all our lives, either directly or indirectly. Today with me, I have Rylee Rieu from the Alzheimer Society of the Rylee River Districts. Rylee, welcome to the show.
Thank you so much for having me, Judy. I'm really happy to be here.
Oh, that's great, Rylee. Rylee, now you work for the Alzheimer Society. Can you tell us a little bit more about what your role is there?
Absolutely. So my role is the Client Services Coordinator with the Alzheimer Society, and our mission is the Alzheimer Society of Rylee River Districts alleviates the personal and social consequences of Alzheimer's disease and related dementia, provides awareness, education, and supports research. So within my role at the Alzheimer Society, I provide caregiver support through our learning series. We have caregiver support groups, one-on-one support, any service that the client needs, we are there to help. We really want to make a difference in the lives of people affected by dementia and their partners in care.
So it sounds like there's a lot of support not only for people who maybe have dementia or Alzheimer's, but also for their families and friends and that. I guess one of the key messages I want to get out to people with this show is that you're really not alone, that there's lots of support that can be provided to people. One of the questions that maybe comes up, Rylee, is we talk about Alzheimer's and dementia. Is there a difference between the two?
So dementia is the umbrella term, and then Alzheimer's disease is the most common form of dementia. So one of the analogies that I always say to people is with cancer. So Judy, if someone mentions to you that they have cancer, what is your next question to them?
I would probably say, well, what type of cancer?
Exactly. So that's what we want to underlay with dementia. So when someone says to you, I've been diagnosed with dementia, what type of dementia is it? You know, is it Alzheimer's disease, which is the most common form? And also now there have been a lot more people that have been diagnosed with the early onset dementia. So one of the things that we want to bring awareness to the community is the face of people living with dementia is changing. It's not people in their 80s and 90s. It's people as young as even 40 and 50 that could be diagnosed. And with that too, a lot of times people at that age demographic are still working full time. They are raising their children, and you know, we just still want to provide support and education to their families, their friends, and for every one person with dementia that's diagnosed, at least 15 people are affected. So that could be between their family, their friends, their neighbors, their coworkers, and as you mentioned before, we all know someone that has been affected with dementia, you know, directly or indirectly.
So it's really good then that there's a lot of support available to people, and I think that really helps clarify some of the terminology because it can be, you know, hard to understand when you don't know and if you're just learning the new language and things around that. I'm just wondering now, can you tell us, say either for yourself or maybe a family, friend, or loved one, you're seeing some changes maybe in their behavior or that. What are some of those signs that you might notice, and what do people do if they have concerns?
So there are 10 warning signs for Alzheimer's, and the first sign is memory loss that affects day-to-day abilities. So one of the examples, have you seen the movie Still Alice?
Yes, I did. It was
Yes.
a great movie.
So in the movie, the actress who portrayed Alice, she was 50 years old, so she was diagnosed with the early onset, and she was a very intelligent woman. She was a doctor of language, I believe, and very well educated. And throughout the movie, it just portrayed her going through the different stages of dementia. And in one of the scenes, I recall she was preparing a Christmas dinner and she forgot how to make pudding, and she actually had her phone and she was looking at the recipe. So that is another sign is for that is misplacing things, finding keys in really weird locations. Like in the movie, she found her phone in the freezer, changes in personality. So really out of character. Sometimes a lot of people in the early stage will become very suspicious of people. Like I had a client, she was really suspicious of her mailman. She would tell her son that, oh, my mailman is stealing from me. And then, of course, as a caregiver, you're like, well, what's going on? We're trying to get to the bottom of it. The police were involved. And then, as it turned out, this woman had dementia, and that was one of like her symptoms.
And that can be scary, both I would guess for the individual and for people that are around you, whether it's a friend or family or a loved one. If you were seeing some of these signs or you had some concerns, what should people do?
So the first thing that people should do is they should refer themselves to the Alzheimer Society, and also to see your family physician or your nurse practitioner if you have any concerns about your memory. And from that, we can work with the individual and the family to get them support in the community, refer us to other community agencies such as the Northwest Lynn Home and Community Care Program, the Canadian Mental Health Association, Older Adults Program, and so many other agencies that we all can help for the circle of care.
I like that terminology, the circle of care. It sounds very warm and inviting and almost comforting. Yeah.
And that's what we want with the Alzheimer Society. We don't want people to be alone. We don't want people to feel that just because they have a diagnosis of dementia that they can't do anything anymore. People are still very capable with dementia, and there's lots of services and programs that are available in our community that can help people. We just need to connect people to the appropriate services, and that's with the Alzheimer Society. We will do that. We create plans of care for all of our clients, and just to make sure that they are safe at home with their, for example, their medication, or if they are risk to falling. We just want people to live safe at home as long as possible.
So planning, ensuring people's safety is a great way to go. A couple years ago, I had the opportunity to participate in the dementia experience, and that was very, very powerful. I mean, when you gave me the list of items, I was afraid I wouldn't be able to remember the tasks I had to do. And so just briefly, can you tell us just a little bit about that experience?
Absolutely. So the dementia experience is a chance to walk in the shoes of someone living with dementia, and we offer this program all year round. In the past, we've had banks go through the training. I did a dementia experience last year at St. Thomas Aquinas High School with the students, and it just really opened people's eyes. And then last week, I did a dementia experience open to the public, and I had a variety of different people between community partners, and I had a few caregivers as well that came through the training. And one of the feedback that I got from a lot of the clients was, wow, I didn't think it was going to be that difficult. And it just really had an impact on people and how they perceive their loved one with dementia. And it's just taking the time to be patient with the loved one with dementia, be understanding, compassionate, because I always think I, try to put myself in their shoes, or anytime, we see seniors out and about on a Saturday morning and they can't remember their debit card or something, and I see people and they're so impatient, and I'm like, for what? I just think, what if that was me one day and I couldn't remember my debit card, and I would still want to be treated with dignity and respect.
Thank you, Rylee. We'll take a break. We'll take a break right now, and we'll return with Rylee Rieu from the Alzheimer Society. Welcome back to Health Beat. Today we're talking about Alzheimer's and dementia, and my guest is Rylee Rieu from the Alzheimer Society. Rylee, I learned so much, and I understand that there are so many programs that are available for the community through the Alzheimer Society. Now, I'm wondering, the programs you offer, are they available just in Kenora or are they available regionally?
The Alzheimer Society, Kenora-Rainy River Districts, we service the whole Kenora-Rainy River District, and all of our programs and services are free of charge to people that are affected by dementia and their partners of care.
Now, if somebody wanted to access your service, can they just pick up the phone and call you, or do they have to go through their family doctor or nurse practitioner?
So we take self-referrals. So I've had people over the years just call the office and say, I was just recently diagnosed with dementia, or, I'm concerned that my mom has dementia. She's been acting totally out of character for the last year. We just want to get some more information. Or even people can stop by our office, 618 9th Street North in Kenora. We have resource library that has books, DVDs, fact sheets with that, and you can also complete an intake with myself to become a registered client of the Alzheimer Society. So that's for the self-referral. And then also too, we really encourage the professionals in the community, so the doctors, the nurses, anyone that works with seniors or people living with dementia and caregivers, to refer to the Alzheimer Society. You are really valued to the Alzheimer Society. You're another outlet to see people that are affected by dementia, and we want to connect to your clients so we can help them as well along their journey.
So again, that key message that you are not alone.
Mm-hmm.
There are caring and supportive people to help you on your journey. Can you tell me a little bit, Rylee, about some of the actual programs that you offer? Because I know there's quite a few.
Yes, absolutely. So one of our other programs that we have is our music project, and that is for specifically people living with dementia. And we started the program, I believe it was 2 or 3 years ago, and we started in Kenora. It was like a pilot project. We received a grant, and we were able to get 2 iPods for 2 clients in Pinecrest. And since then, we now have about, I believe, 60 or so clients throughout the whole district that enjoy the music project. So with that, we meet with a family or a caregiver just to get to know the person living with dementia, figure out what kind of music that they like to listen to, and we have access to 300,000 songs. So
wow.
The possibilities are endless. Like, I did an iPod the other day with like Italian music, Spanish music, so that was really amazing. And music really is one of the things with people living with dementia, regardless of what stage in the disease they are. If they're in the early stage to the late stage, people with dementia really enjoy their music, and it's one of the last memories to leave someone with dementia. Like, I'll give you an example, Judy. I have a client, she's in Pinecrest, and she is in the late stage, and she has lost the ability to speak. But with her music, listening to it, on a daily basis, she is still able to sing Amazing Grace or other songs that she's listened to her whole life. So that is a really impactful program that we offer. And we also, too, we have a few volunteers that actually visit the clients as well. And I know, talking to those volunteers, that they just really enjoy that. So we're also looking for volunteers to help with the music project. We're always looking for donations of gently used iPods, over-the-ear headphones, iTunes gift cards, monetary donations, just to help with that project.
That sounds very exciting, and it sounds like a lot of people are benefiting from that.
Yes, for sure. And then another one of our programs that we have for people living with dementia is our Finding Your Way program. And with that, so that is for people with dementia, and we're asking families and caregivers to fill out. We have an identification kit available at the office, just because 3 out of 5 people with dementia at some point in the disease will wander or get lost, and we want to prevent that from happening. And if for whatever reason, if your loved one is taking your dog for a walk and they get lost on a street and you're really worried about them, fill out the identification kit, include a recent photograph of your loved one, and I recommend people to keep it on their fridge or even in the glove compartment of their vehicle, because a lot of times when people are in crisis, everything just goes blank. And if they see this ID kit in a location that they is common, then they're able to reach that information and give the kit to the police or the searchers.
Is there any other program you'd like to share with us?
So through our First Link program, we have our learning series coming up in October, and we offer that throughout the whole district. My coordinator in Dryden, Heidi, she will be offering her learning series through the Ontario Telehealth Network, so we can reach clients in the remote communities such as Sioux Lookout, Ignace, and then even we have clients too in the Red Lake and the Ear Falls area as well, and even in Kenora and Fort Francis. They're all welcome to join. You just have to become a registered client of the Alzheimer Society, and you're able to attend our learning series, our support groups, just because confidentiality is really important to our society. And just it's kind of like AA, very private and personal conversations, and it's just a really great way to learn about dementia, what to expect. We bring in a variety of different guest speakers as well, to talk about their programs and services and how they could help people living with dementia and their caregivers. And one of the last programs that I'll mention is for professional caregivers. It's called our You First program, and that is an amazing program. We talk a lot about like the pieces module, so we see the person with dementia as a whole person. And if any professionals in the community are interested in the You First training, please do not hesitate to give our office a call. We can set up anytime, and we travel throughout the whole district. Last year I was in Dryden, and then in the springtime I was in Ear Falls, and we provide to the First Nation communities as well.
Is there a charge for that one?
There is a charge. I believe it's $75 per person, but just please contact the office to get further details for that program.
That's great. So all along the continuum, there is lots of support out there, right, for healthcare providers, to families, to the individuals who maybe have dementia or Alzheimer's as well. I'm really hoping that this will be valuable to a lot of our viewers who maybe don't know about the services and that you offer. I know I'm certainly learning a lot having you in here today, so that is really, really great. And we'll be back in a few minutes. Right now we're going to take a short break, and then we'll be back with Rylee from the Alzheimer Society. Welcome back to Health Beat. Today we're talking about dementia and Alzheimer's with Rylee. from the Alzheimer Society. Hi, Rylee.
Hi.
That was great. You told us a lot about the programs that you have at the Alzheimer Society. Is there any other ones that you'd like to mention that you'd like the public to know about?
For sure. So another program that we have is our Touch Quilt project, and we have amazing amount of touch quilts that have been donated to our society by caring volunteers. And what the touch quilt is, it's a sense of stimulation and comfort. So it's basically a lap quilt with a variety of different textures and even different activities too on it. So we have ones with buttons and zippers and strings that people with dementia can, if they're fidgeting or anything like that, and it's supposed to calm them down, give them that sense of purpose and stimulation. And one example that I had years ago when I first started is I gave a touch quilt to a client with, it had like a furry sensation on it, fabric, and the person living with dementia, he hadn't spoken in a couple months, and after feeling that texture, he actually said the word dog, and I mentioned it to his wife, and she said, oh, when he was a little boy, he had a beautiful German Shepherd, so he relayed that feeling of that fur texture to a dog running through his legs.
Wow, so that sensory memory was there, and then he was able to recall.
Yeah.
So that's a good example, I think, of just how the touch quilts can have an impact on somebody's life.
For sure, and we give them out to people living at home if they're in the hospital, in long-term care, and again, if you are a healthcare provider or a caregiver yourself and you're interested in getting a touch quilt for your loved one, please contact the office and we would be happy to give you a touch quilt.
Excellent. I understand now that there's a memory clinic in town. Can you tell us a little bit about that?
Yes, absolutely. So we've had our memory clinic in Kenora for almost 3 years. And with the memory clinic, it's a multidisciplinary team of doctors, nurses, social workers, dietitian, pharmacist, and representation from the Alzheimer Society. And we work very well as a team. We want the best for the patients and their families. So with the referral, it's from a professional or a doctor or a nurse, and they are seen at the memory clinic with their caregiver, and the person with dementia will go through some cognitive screening tests, and then while that's going on, we interview the caregiver, because a lot of times the caregivers are afraid to talk about what's been going on in front of their person with dementia, especially around the driving. That is a huge issue, and we just want people to know that, the memory clinic is an amazing program. We are there to help you. We are there to provide supports in the community, referrals to the Alzheimer Society for education and support after the diagnosis is given. We also can refer to, say for example, the OT at the Northwest Community Land and Home Care Program for that. And it's just really an important program, and the feedback we've gotten from the community has been overall very beneficial, and people really appreciate the memory clinic and the Alzheimer Society as well.
So the memory clinic in Kenora, that can still be accessed by people throughout the region, or is that just a local program?
It's just a local program.
Okay. That's great. Is there any other programs that we haven't chatted about that you wanted to let people know?
Another opportunity that we have is we're always looking for volunteers at the Alzheimer Society. We have lots of variety of different activities to sell our cash calendars, our 50/50, or even to help out with our music project to load the iPods. We're looking for students that need their volunteer hours, for school. Please feel free to contact the office if you are interested in volunteering. And then we have our big Taste of Kenora dinner always in May.
I hear that's really popular.
It's very, very good. You should come next year. Yep. So we're always looking for volunteers to help at a variety of different capacities with the Alzheimer Society. So if you are interested, please feel free to contact us at the office.
And you've been there, I understand, for about 5 years working with the Alzheimer Society.
I have, yeah. It's almost closer to 5.5 years, actually. So next month will be 5.5. So, yeah, I love what I do. I love helping the clients, the people affected by dementia, giving presentations to the communities, just reaching out to people that maybe might not know about our service and our programs, and then seeing the light go off that, the information that I'm talking about to them. I've had people over the years say, your presentation was really good. I'm really concerned about my mom now that you say the warning signs or, out of character things that are happening at home, and, they just want to get more information and support from the Alzheimer Society.
Rylee, is there anything that we haven't talked about or that I haven't asked you about that you feel is really important for our viewers to know, that is a message you'd like to get out?
So one of the last messages that I really want to let the community know is, for the Alzheimer Society, we want to reduce the emergency state for our caregivers. We don't want people calling us in crisis. We want to alleviate that. That's why we want to educate as many caregivers, professionals, people in the community as well, because unfortunately there still is that stigma around dementia, and we just want people to continue talking about it. Don't be afraid to come by the office, to contact us if you are concerned about your loved one's memory or even your own memory as well.
Great. Thank you very much, Rylee. This has been really awesome. I know I personally have learned a lot today about the programs and services and what you offer at the Alzheimer Society. So I think this will be really good. And I want to thank you very much for coming in today.
Thank you.
Today we were talking about Alzheimer's and dementia with Rylee from the Alzheimer Society. That's it for today, and we hope you'll join us on Health Beat again. Thanks for watching.